Welcome to the stuff you should think about. I'm your host, G. And in today's episode, we're talking about beyond the surface, how face transplants actually work. Imagine looking in a mirror and seeing a stranger's features staring back at you. It sounds like a plot of a sci fi thriller, but for a select few, it's a life changing medical reality. Today on the podcast, we're peeling back the layers, literally, to talk about one of the most complex, controversial, and awe inspiring procedures in modern medicine: the face transplant, the science of the impossible. When we talk about an organ transplant, like a heart or a kidney, we're talking about replacing a vital pump or filter. But the face is who we are. It's our identity, our expression, and how we interact with the world. So, how do surgeons perform a face transplant? It's not just stitch on a mask, it's a grueling 20 to 30-hour marathon involving dozens of specialists, including plastic surgeons, neurosurgeons, and immunologists. The three pillars of procedure. To understand the surgery, you have to break it down into three pillars. First, the preparation, the donor tissue. The process starts long before the donor arrives. Surgeons use 3D modeling and virtual surgical planning to map the donor's skull and tissue structure against the recipient's. It's essentially a high stakes puzzle where every millimeter matters. Next, there's the connection, the vascular and neural network. The actual surgery is a game of microscopic connections. Surgeons must carefully dissect the recipient's blood vessels and nerves. Then they reconnect them to the donor's tissue using microsurgery. If the blood vessels aren't connected perfectly, the transplanted tissue will die. If the nerves don't heal correctly, the patient won't be able to smile, blink, or express emotion. Lastly, there's the immune bridge, anti rejection. Here's the catch: your body is hardwired to reject foreign invaders. Because a face contains skin, muscle, bone, and nerves, it is highly immunogenic, meaning the body really wants to attack it. Patients must undergo a lifetime of powerful immunosuppressant drugs to ensure their body accepts their new face. The emotional reality. The surgery is only half the battle. After the bandages come off, there's a profound psychological adjustment. Patients are tasked with learning to use their new muscles, often requiring years of speech therapy and physical rehabilitation. And then there's the identity paradox. Most patients report that while they feel like themselves again, they also feel a deep sense of gratitude towards their donor. It's like an exercise in extreme empathy. Carrying the physical essence of another person to reclaim a life that was once lost to trauma or disease. Why do we do it? With such high risks and a lifetime of medication, why pursue this? For patients who have suffered catastrophic facial trauma from burns, gunshot wounds, or cancer, the world often becomes inaccessible. A face transplant isn't about vanity. It's about being able to breathe, to chew, to speak, and to be seen in public without being defined by a deformity. It's about restoring the human connection that we all take for granted. Face transplants remind us that we are more than just our skin. We are the sum of our experiences, our resilience, and our ability to adapt. While the science is incredible, the true marvel is the human spirit. the drive to heal, and the willingness of donors to give the ultimate gift. Thanks for joining us for this deep dive into the science of identity. If you enjoyed this episode, make sure to leave a comment and a review. And remember, every face has a story. What's yours? This podcast is for educational purposes only. If you are interested in medical advancements in transplantation, please consult peer-reviewed journals or official resources from major medical institutions like the Cleveland Clinic or NYU Langone Health.